The Pope represents a very important spiritual leader for the whole world, whatever your denomination or religion. And as such, as I was recently made aware, I think I knew he had been unwell, but I didn't realize he was very unwell. And so I did a little bit of research around it, which is what I'm going to share. And I think I'm sharing some clinical insights because if the Pope can be so severely affected, even when all around him are all the resources and everything that he should need, what does it mean for much of the older community across the world? So I think this is an important clinical reflection, and it is hopefully that if I give some insight for those people who pray, maybe it will show you where to pray to direct what happens to him in the next few months. Because if my instinct is right, this could be quite a significant illness that he is having. So, I'm going to take you through a few of the clinical insights and some of the information I've pulled together and share with you where I think this could be in the near future. As usual, before I start, I'd just like to remind you that coming up very shortly is that important discussion. And again, this is a clinical insight into the unseen threat, measles, the connection between measles and COVID. And as I said, a lot of people may misunderstand how important this is. And hopefully, by the end of this presentation, you will realize why I think this is a very, very significant illness to be affecting, certainly the USA. And my prediction is other parts of the world as well. So let's get back to this question as to what really was happening with Pope Francis. And you'll see the kind of thinking and research that I do here. And what I'll be showing you is some insights from Grok, which is AI. Now, what it's good at is giving a lot of information and distilling it quite quickly. And this then gives me a picture that I can then use to try and make some clinical extrapolations. So let's go through the timeline as to what exactly was happening and see how this relates to what I'm talking about. So we can see here that in late December 2024, he had a minor fall in the Vatican. He's 88 years old. That's not surprising. He was okay. And then in early January, he had another minor accident, hitting his arm against the table, had some bruising, and again, he's 88 years old, not too much of a concern. What this is the first relevant bit. On the 25th of January, whilst leading a prayer service at the Basilica, um, this was his last significant public outing outside the Vatican City before his health declined any further. And he was able to manage the event despite his recent injuries. So, first, you have to look at the last time that he was well, the 25th of January. And it's one of the important questions that I usually ask patients: when were you last well? And that then gives you a timeline that could be relevant to clinical presentation. So, what then happens is on the 1st of February, he again attends a jubilee. So, this is about a week later. And this was the last public appearance. And at that time, this is the bit, report suggests he was already dealing with a lingering respiratory issue, later identified as bronchitis. So this is a very important link because he had a public appearance in January. He would have been with a lot of people around him. Then in February, and the 1st of February, a little about a week later, he is having already a respiratory illness. And so this is the first clinical bit that you need to understand. And this is where it comes to what we call the bronchitis. And sometimes the COVID bronchitis, this is what really I'm focusing on. I'm using this timeline to show you some of the ways that COVID can present. Now, it's important to know this is just my clinical analysis. I don't have any information at all. But based on how I see disease present in other patients, it's not an extrapolation too far to say, okay, that makes sense. So, just so you understand the point, is that this is your normal healthy lungs. You have these trachea, bronchi, bronchioles branching to all different parts of the lung on both sides. No problems here. But if you then have that 100-day cough that some people talk about with COVID, you then get an inflamed bronchus. And this then causes this cough because you're trying to get air out and it's sometimes very tight. Some people get a little bit wheezy. And this is technically the bronchitis. It's the larger air passages getting a bit inflamed with some edema. And a part of the process is a cough. The reason why I've mentioned that is largely because the 100-day cough, so to speak, that they have seen with COVID fits that pattern. And that's what I said with regards to the lingering respiratory issue that he had. And so you then have that was on the 1st of February, as I said, and you can see here by the 1st of February, he has this lingering respiratory issue. And then in early February, he's battling this bronchitis, which is limiting his activities. He's short of breath. They can't quite find an exact onset, but it alters his schedule. And I would suspect at this point, he's also having some of the fatigue that's associated with it. And the importance with this timeline is that if you have any older relatives or if you yourself are not so well, what you have to look at, the fatigue is a really important symptom and it knocks people off, but they don't seem to necessarily have a lot of other symptoms. So they think it's okay. So let's follow along. That's early February. Then what happens is on the 9th of February, during a celebration at St. Peter's Basilica, he looks visibly unwell. Okay. And they think that it's his bronchitis. He then shifts his meetings. So again, you can see early February up to the 9th of February. This is now 2 weeks since that initial onset where this could have been the high exposure events on the 25th of January. And so people don't make the connection because at this point, he's a little bit more unwell, nothing specific. And the reality is that with regards to a COVID test, so even at that point, if they decided to do a COVID test, very often it would come back negative because this is no longer just about the virus. This is now about the virus triggering inflammation in the lungs. And very often they can have a negative COVID test. And therefore people think, oh, well, it's not COVID. I always say from a clinical point of view, is COVID a lab diagnosis or is it a clinical diagnosis? If you have a negative COVID test with all the symptoms of COVID, is it COVID? From a clinical point of view, of course it is. Just because you have a negative test, it could be the test, it could be the timing of the test, it could be a number of other things. But if clinically the symptoms fit, then it is likely to be COVID. So let's just go back again. So now on the 12th of February, so at this point, he has this bronchitis on the 9th. He shifts his meetings. Then he's at a general audience and he's unable to read his full prepared remarks due to breathlessness and fatigue. And they assume from his bronchitis. Now, bronchitis, unless it is an active bronchitis, and you can have quite a chronic bronchitis, is very often just inflammation of the airways. It causes a cough. It's a little bit annoying. You can sometimes have a tight chest, but the fatigue and the breathlessness, unless he has underlying lung disease, doesn't quite fit. So that was, as they said, the last major public event before hospitalization. So this is on the 12th of February. And then on the 13th of February, his condition continues to decline. And then the Vatican notices as when he has flu-like symptoms starting to intensify. This is very important as well. The flu-like symptoms represent interferon. That's what usually makes people feel quite unwell. It's a surge of interferon. And it suggests that what he could be having is not just simply a bronchitis, but more of a viremia. And this is what I call in terms of the viral sepsis. That's another way of putting it. So, and just to show you what this looks like, is that at this point, the virus has infected the upper airways, it's continuing to replicate. As I said, because this Omicron tends to go in the sinuses, sometimes the swabs are negative and they're not necessarily positive at the back of the throat. It's spreading down to the lungs, it's breaking through the mucosal immunity. And now, once it gets into the systemic circulation, this is now where the flu like symptoms can suddenly appear with interferon surge. He'd start to produce antibodies and just feel generally unwell. And that's an important phase in terms of what is happening with regards to the illness. But at the same time, if he has been unable to control the replication, you then have virus circulating in the bloodstream and replicating and spreading in endothelial cells. This oftentimes can make people get quite sick. And because the virus is suppressing interferon, it's damaging the lymphocytes as well. So the immune system overall starts to get overwhelmed. And you have to remember, he is still 88 years old. So this is not a young person. This is relevant in somebody who is older. So then we have on the 14th of February, that's then he was admitted to hospital in Rome. He presented with flu-like symptoms, fever, fatigue, and respiratory distress that have progressed into a bilateral pneumonia. And that in itself is quite telling, bilateral pneumonia with serious respiratory infection, and he begins treatment with oxygen and antibiotics. And this is the bit that is very important with the oxygen and antibiotics. And this is why I'm saying what I'm saying here, is that very often when you have especially the inflammatory component of COVID, what you can then have is secondary bacterial infection. So the person gets what appears to be a bilateral pneumonia. So if you look at their chest x-ray, and I think I had a chest x-ray here just to give you an idea as to what it could look like. But they have the chest x-ray, and they may have a pneumonia. So this is what it would look like or could look like. In this case, this is the lungs. This here represents the pneumonia. Now, this is just one side on the right-hand side of the chest. However, if you then have inflammation affecting both sides, you can then get bacteria causing infection on both sides of the lung. And this is now what it would look like. So the COVID pneumonia here, so normal pneumonia very often is confined to one side of the lung, unless it's a bronchopneumonia where it's spread all throughout the lung. But very often it's a lobar pneumonia, it's confined to one side of the lung. This pattern that occurs bilaterally, so once I hear bilateral pneumonia, in the context of someone being unwell for 2 to 3 weeks with flu-like symptoms, very high on your differential should be a COVID pneumonia. And that's what I suspect was really the whole run-in in terms of what happened to the Pope. Now, the reason why this is so important, and this is not just talking about him being unwell, because this has very important clinical relevance if you have older relatives, because this is where it gets very, very complicated and where we really have to watch out for his health. Because when they looked at the hospital and mortality burden of COVID-19 compared to influenza in Denmark, it shows some very stark numbers. So when you go down in the paper here, and I just want to show you this image here, when we look at what happens in terms of influenza, number of hospital admissions, and number of deaths within 30 days of a hospital admission, this is what happens. And you see over the 2-year period, these clear peaks with influenza. With COVID, however, There is no clear peak. It's just ongoing. And when you compare the gray part is the number of people who died within 30 days. This is a beast of a virus in terms of the impact that it can have in terms of mortality. So the mortality rate with regards to COVID, and this is why the diagnosis is so very important, because if they don't know that it's COVID, they may treat it with less seriousness than if they think it's just a bacterial pneumonia. And I would guess, because he is still in hospital, that was from the 14th of February, that he is not having a straightforward health journey. Because usually, if you've had a pneumonia, you get your antibiotics. A few days later, you're starting to recuperate. Within a week, you should be up and about. Within 2 weeks, you should be coming close to the baseline. And even though he's 88 years old, I would expect within a month that he would be up and about, probably starting to do some light functioning. However, it doesn't seem as though that's the case. Now, when we look at the overall picture with all patients of all ages, 9.7% of hospitalized COVID patients die within 30 days of admission. This is a huge number, technically 1 in 10. If they are hospitalized just with a diagnosis, and I'm not talking about severe COVID, if they just have a positive diagnosis of COVID, within 30 days, there is almost a 10% mortality. And this is very, very important in the context of what I'm talking about here. Because if this is the case, then what will happen is that we have to therefore look very, very carefully at what are the outcomes in terms of his health. When we look at here, and this is showing us that's 9%. Sorry, I'm getting the same image back up. But what we're seeing here with regards to this is that up to 12% of over 65-year-olds end up with increased mortality or death within 30 days. Huge numbers. And then it brings into play the other part of the picture, because the Pope is still 88 years old. He's older. He is therefore less likely to have the same amount of resilience. And that's when you hit the post COVID symptoms. And the post COVID symptoms, because based on what we're finding, is that once the virus gets into the bloodstream, gets to the intestines, starts to replicate there, gets into the bacteria in the intestines, continues to replicate there. If they are not aware that they have to address the gut bacteria as well, they will be thinking he just needs some antibiotics and he'll be okay. No, these patients continue to struggle for weeks, sometimes months, because of ongoing production of spike protein in the intestine. We're only just coming to the point where hopefully soon a company is developing a spike protein test that will differentiate where it's coming from, not just from the virus, not just from the vaccine, but whether or not it's being produced in bacteria. If you're interested in that, please look in the description below, because the people who are interested, I'd want to give them the opportunity first to take a look at this, and we can see how effective it is. But this is very serious, because for an older person like that, if you understand that it is COVID or COVID related, they have to go about clearing the bowel. They need to develop strategies that would deal with bacterial toxins. They need to consider immune suppression, because even though it was a bacterial infection, it was on top of an inflammatory lung condition. And so, if you don't deal with the inflammation, you will then get recurring bacterial infection, and the person will first get well for a week or two, then they get another infection. You treat them with more antibiotics, they get a bit better, then they get another infection. This sounds like what is occurring in his case, because he is still in the hospital environment. This is coming up now to over a month. Very important information for us to understand, because without us having the tools and the understanding to treat even the Pope in an effective way, what does it mean for much of the older population? And so when people listen to this here, you have to understand that the reason for raising awareness of this is because there are so many people who are concerned about the wellness, the health, and the well being of the Pope. And they'll be concerned about what can be done to protect his health, to protect his well being. The same amount of attention must be given to all older people who may be exposed to COVID 19. I tell you what, at the end of the day, the same virus that caused the world to be locked down, that caused implementation of vaccine mandates, that killed millions of people, is still circulating. Why is it that no one seems interested anymore? And it's certainly not because the virus is dangerous, because as I said, across the board, if someone is admitted, no matter what the age, it's a 10% mortality within 30 days. That mortality is much higher if you're over 65. 12% mortality. It's less than 1% if you are fit and well and below 44. But it means that this virus is still causing severe damage across the population. We need strategies now that will be able to address this. And the first and the most important thing that needs to be done is acknowledgement. Without acknowledgement about the seriousness of what we're facing, it's likely that people will continue to ignore it. More people will die, and the outcomes are going to be poor wherever we are. Let's hope our best and put our prayers in for the Pope and for the doctors taking care of him, that they will make sure to protect his health and well being in the near future. Have a good evening.